Welcome to Great Ormond Street Hospital. We are one of the world's leading children's hospitals, attracting hundreds of international medical students every year. With over 63 clinical specialities, there is no limit to the variety students see. Whether you're walking through the colourful corridors or sat by the historic Peter Pan statue outside, this state-of-the-art hospital, placed in the heart of London, will never leave you with a dull moment. Around the corner from GOSH is the Institute of Child Health, where together with GOSH, the largest concentration of children's health research in Europe is conducted. And with students having access to the hospital and its libraries, there is lots to be learned at Great Ormond Street. Alongside the placement, there's many fun places to explore in your free time. Shops, bars, restaurants, architecture and more. And with close access to Russell Square and Holborn Station, this medical elective experience is truly like no other. Working with the PGME department based in Weston House, we have spoken to some of our international medical students to find out more about their experience of their elective at GOSH.
So the main reason that I chose to do a rotation at GOSH was that I knew that the standard for healthcare here and the nurses and physicians and staff were just so committed to the patients, and I felt like this was an environment where I would learn a lot from positive role models and see a lot of cases that I wouldn't be exposed to otherwise. And I found that's definitely been the case.
When I decided to do the Erasmus trainship, I searched on internet which is the best hospital in the UK because I would like to come here. So I saw that GOSH, it is a very, very important hospital also to a particular disease. So I decided.
I chose this hospital because I love pediatrics and this is one of the most important centers of all Europe.
So I chose the dermatology department. I really want to be a dermatologist. I feel like it's a really cool combination of surgical and medical specialties, and I found that the dermatology department here was really immersive.
I choose neurophysiology, but I stay also in neurology and neurosurgery department.
So the best way I found to organize my placement was to identify a mentor in the department, and then I coordinated with them in the PGME department to figure out the best way to fit my placement in.
I searched on internet how I can do the application. I sent an email, I sent the application form, and I need two reference letter from my two professors of university.
So for dermatology, a lot of the clinic days are outpatient. So I'll arrive early, read over cases with my fellows, and we'll basically get a lay of the land for the day. Sometimes the night before, she'll send me a list of cases that I can read up on so that I'm prepared, because they'll see cases that are much more rare than I would normally encounter, and oftentimes I don't even know it'll come through the door. I've never seen that case before. So it's really cool opportunity to learn about these cases before, see them in person, talk to the patients, and then learn from the families because they know so much about these diseases and conditions. So usually we'll see patients maybe 8 or so in the morning, and then some in the afternoon. And usually in the afternoon we have a biopsy to go to, and intersprinkled in the mornings are oftentimes histology or genetics lectures.
Sometimes there is a ward round, so I go to neurologic ward round. Other days I went to the meetings, and sometimes when there is a clinic room, I go there to visit the patient.
At 8:30, we have the cardiology meeting, and here the consultants and the fellows discuss the most important cases of the week. Then after, I am free to choose between doing the round of the bed and see all the patients, talking about the therapy and so on.
I'm seeing much more rare and informative conditions here because it is such a specialized hospital. This placement is a really good opportunity to see rare genetic conditions and rare congenital conditions that I wouldn't normally be exposed to and figure out the best ways to manage those from the people that are the experts.
Here I can see a lot of particular cases that in Italy probably we don't have.
Before being here, I tried to improve my English following a course that was organized by my university. A very useful thing for me has been to watch TV series in English with English subtitles, and I think that they also are very kind with me. So when they talk to me, they understand that maybe they have to speak slowly, and for example they underline the pathology and the keywords and so on. So don't worry for the future students if the first days you say, "What? I haven't understand nothing." With time you will improve.
I love markets. There's tons of markets around here in London. Some places that I would definitely recommend are the Top Secret Comedy Club. I also really like Clapham Commons, and then the Old Truman Brewery usually has fun events from cocktail nights to different types of fun shops and markets and things like that. So I recommend those.